sir.
My name is Saad, and I'll be your nurse today. Just going to sanitize your hands. Can you confirm your name and date of birth?
Godson Okonkwo, June 17th, 1965.
Okay. So what brought you to the appointment today?
I have a new job and my manager wants me to get a physical done before I can start my job.
Okay, so that's a good plan. So before your job, you do a physical exam. That's a good plan. So I will just do the basic history. So are you in any acute pain right now?
No.
Okay. Any chronic pain?
No.
Okay. Do you do you have any drug allergies?
I don't have it.
Okay. Do you have any allergies in general?
No.
Okay. So I'm just going to do a little bit of social history. Do you smoke?
No.
Okay, that's good. Do you drink daily?
Not daily, but I drink maybe 2 glasses of wine twice each week.
Okay.
Yeah.
So that's okay. And then do you have any family history we should be concerned about? Family history of stroke or ischemic heart disease?
No.
Do you have any symptoms like any chest pain or any dyspnea?
No.
Okay. And what is your exercise routine like? Do you pretty much exercise daily?
Not daily, but I go to the gym at least 3 times each week.
Okay, that's good. So I would suggest for the cardiopulmonary benefit, we will try to do like 30 to 40 minutes of cardio exercise at least 5 times a week, and try to raise up your heart rate and stay there, and then slowly bring it down for longevity. Okay. All right. So moving on to the next part. Oh, well. Judo vitals. Okay. And starting video pulse. Okay. Okay, so your pulse rate was 64 beats per minute, and your heart rate was, your respiratory rate was 14 breaths per minute. So that's within normal limits. So that's good. Next, I'm going to check your blood pressure. Okay, just relax your arm. So your blood pressure is 126 over 78, okay, the normal limits. So that's good. I'm just going to write it down. Okay, so couple moving on to your head. So do you have any history of headaches or any seizures?
No.
Okay. Do you have any okay, so upon inspection of your heads, I do not see anything unusual, no lesion, no scars, and I'm just going to palpate your head. Okay, so cranium looks symmetrical. I did not notice any bumps or lumps or any contusions. That's good. And what is your hygiene? Like, do you?
I take a shower at least twice each day.
Oh, that's pretty good. Okay.
Yes.
Okay. Alrighty. So moving on to your eyes, like how well do you see? Do you wear contacts or any glasses?
Yeah, I do use glasses for short-sightedness, but I don't use it every time.
Okay.
Yeah.
Okay. And do you see your eye doctor?
It's been a long time since I saw an eye doctor.
So I would recommend seeing your eye doctor at least once a year, so for regular screenings and so they can keep an eye on you. Okay. And Abul, can you do this for me? Okay. So on inspection, the scleral conjunctiva look intact. There is no pallor or no unusual redness, so that's good. So I will just try to follow my finger without moving your head or your neck. Okay. Okay. So that's good. Normal eye motions. So that's good. I think I have it. If I can find it, okay, yeah. I have it. Okay. So I'm just going to reflect the eyes in your left and your right. So I'm looking for the constriction of the pupil. Okay. Just look straight. Okay. So the perla is normal and the constriction of the pupil is symmetrical. So that's good. So we can say the optic nerve 2, 3, 4, and 6 is intact. And then moving on to your nose. Do you have any history of trauma to your nose?
No.
Any deviated septum?
No.
Okay, and can you smell well? Like,
Yes.
okay. You do not smell any phantom smells or anything? Okay.
No.
No history of nosebleeds?
No.
Okay, so that's good. So we can say optic nerve 1 is intact. And then how's your chewing? Like, do you have any problems swallowing?
No, I have no problems swallowing.
Okay, that's good. And I'm just going to palpate your jaw a little and just try to chew. Okay. So cranial number 5 is intact. And then can you also inspect your mouth? Do offer me. Okay, so I do not see any unusual gum bleeding, and teeth look symmetrical, and you do not have any history of bleeding gums or.
No.
And do you see your teeth doctor, dentist, or usually?
I think it's been more than 2 years since I last saw my dentist.
Okay, so I would recommend seeing a dentist at least once a year for like, even if it's just for regular cleaning and stuff. Okay, and for screenings. And okay. And can you stick your tongue out? And move it right, left, up, and down. Okay, so we can say cranial nerve 12 is intact. And then can you give me a big smile? And then frown your eyebrows. Okay, and then puff your face like a puffer fish. Okay, and look like very alert to me. Okay, so we can say facial nerve 7 is intact. And then I'm just going to say something. I need you to cover your right ear, okay?
massive life.
That's good. For your left ear. 65.
65.
Okay, so that's good. So you can say cranial nerve 8 is intact. And do you have like normal gag reflex? You can swallow well.
Yes.
Okay, so we can say cranial nerve 9 and 10 is intact. And can you shrug your shoulders for me?
Yes.
Okay. And I'm gonna apply some pressure. Ooh, no shrugging shoulders. So patient did not have any problem against resistance, and you can say cranial nerve 11 is intact. Okay. And then it's a basic neurology exam. Do you know where you at right now?
Yes.
Where are you?
I'm at the clinic trying to get my physical done.
Okay. You know what month is it?
June.
Okay. And do you know me?
Yes, you're the nurse.
Okay. All right. So patient is alerted and oriented ×4. So okay, moving on. I will move to your neck. So. So do you have any neck pain or neck stiffness?
No.
So you said you have no problem so much. Okay, so upon inspection, your skin looks appropriate, and I do not see any lesions or scars, and it looks normal for your age and ethnicity. So I'm just going to palpate a little, and I'm going to palpate here, and you do not feel any pain, right?
No pain.
Okay. So we can see the lymph nodes in these regions are not tender, not swollen. Okay. So also, can you do this for me? Do this and move it the other way, and move it up and down. Okay, so that's normal range of motion. So next, we will do your respiratory exam. Okay, so I will listen to your posterior chest, and then I'm going to need you to take a deep breath in and out when I push the stethoscope on your back. Okay. I'm also going to do laterally. Okay. This side. Okay, so I do not notice any wheezing or any freckles, so that's a good sign. And we already talked about it, so you're not as well. And then, and can you get up, please? I'm going to do a little bit further your respiratory exam. Okay, can you take a deep breath for me? Do it again. Okay, and I'm going to palpate here, and I'm going to say 99,
99.
99,
99.
99.
99.
Okay, so the chest wall expansion is symmetric, and the tactile firmness was intact, no problem there. And vertebral column upon inspection is midline, so that's a good sign. I do not see any signs of deformity. Okay, so moving on, I will do your percussion, and I'm going to do the same thing. So just expect tap sounds in the same spots. Okay, so the tapping sounds were symmetrical and hollow, and I do not see any sign of abnormality there. I'm going to inspect your back. You do not feel any tenderness or any pain. That's good. All right, so moving to the front. Down for me. Okay, so upon inspection, I do not see any lesions or scars, and the hair pattern looks symmetric, uniform. That's good. Okay, so I'm going to listen to your breath sounds in the front. Okay. Same as before, I did not hear any signs of wheezing or any crackles, and the ear motion was symmetrical in both ones. And I'm just going to inspect your chest. You do not feel any tenderness or any pain when I touched it. Okay, that's good. Okay, so moving on to your heart. Well, just 5 points of auscultation on your heart. It started from the aortic area. And the pulmonic. And the Erb's point. And the tricuspid. Okay, and at the mitral area, I'm going to do the apicals for a whole minute, okay? So just bear with me, please. Sorry. Okay, so your apical pulse was same as your radial pulse, so that was 64. And I did not hear any heart murmurs or any extra heart sound, and S1 and S2 were well preserved. So that's good. And as you said before, you do not have any chest pain with exertion. And okay. So moving on, can you please lay down for me? We will do your abdomen. You do not have any history of diarrhea or constipation or vomiting. And no family history of GERD, acid reflux. Okay, so upon inspection, I do not see anything unusual, any lesion or scars. The umbilical look midline, so that's a good sign. So I'm going to auscultate, starting from your right lower quadrant. Just take normal breaths. Right upper. Left upper. And left lower. Okay. So I did not hear anything unusual. The sounds were nothing out of ordinary. And I'm going to, sorry, I'm going to have you going to practice your abdomen. Just bear with me, sorry. So sounds were equal bilaterally, and the tympanic sound was predominant.
Okay.
So that's a good sign. Okay, so next we will move to your extremities. So do you have any pain in your calf when you walk or when you exercise?
No.
Any edema in your leg?
No.
Okay. So I'm just going to inspect. I'm just going to pull it up a little. Sorry. I'm just going to expose what's. So the skin looks intact. The hair growth looks symmetrical. And I do not see any signs of lesions or scars or any open wounds. Okay. And same thing on the feet. No edema. I'm just going to palpate your dorsalis pedis. Okay, so equal strength +2 bilaterally. So that's a good sign. Then you can sit up for me, please. Okay, can you do this? Okay, so the skin looks intact, uniform hair growth bilaterally, and it looks appropriate for age and ethnicity. Okay, and just flip your hands. Okay, and you have no edema or any pain in your hands?
No.
Okay, so I'm just going to check your capillary refill. Okay, so the capillary is normal and it's less than 2 seconds actually. I'm going to check your turgor. So that's like if you have any enough water in your body and if you're not dehydrated. So that looks normal, so that's a good sign. Okay. And so next we are going to do, let me check a radial pulse bilaterally. So do make sure. Okay, so radial pulse is +2 bilaterally and is symmetrical. Okay, so next we will move on to your musculoskeletal system. And do you have any pain in your joints or in your muscles?
No.
Like no family history of rheumatoid arthritis? Okay. And you said you exercise almost every other day, so that's good. Okay. So can you stand up for me, please?
Yes.
Okay, so first I'm gonna have you do this knee flexion and extension, and do it with both. Do it with the right. Okay. So normal range of motion. I'm going to apply some resistance. Just try to move, flex it. Okay, and then push against it. Same thing here. Lift up your leg. Okay, and then push against it. Okay. Alright, so normal range of motion and against resistance, it stays the same activity and against resistance. So next I'm gonna have you do this. Knee, hip flexion and extension. Just do it and do it with your right. Do it like this. Okay, so it looks symmetrical and in the same range of motion. Range of motion is good. And then I'm gonna have you do the flexion and extension of the hip. You can do it with that. Okay, and I'm going to apply some resistance. Just lift up your leg and move against it. Okay. And then, can you sit down for me, please? Just try to lift up your leg. Okay, so that's good. Try to lift up your leg. Okay, so the strength of the hips are equal bilaterally. And can you do this for me? Inside and outside movement. Okay, and move it up and down, the dorsiflexion and the plantar flexion. Okay, normal range of motion. So I will be doing it against resistance. I'll just lift up your. Okay, just push it back, and push it up, and push it to the. Okay, push it to the side. We do the same. Move it to the left, and then to the right, and then up, and then down. Okay, so normal range of motion, normal strength of the muscles, and yeah, so everything looks normal. So I will just, for the last thing, I will have you stand up, please, and can you like take a walk from here to there, and can you like take your toe on the way back, please? Okay, so normal gait. We did not see any legging, so that's good. And next, I'm gonna check your coordination for your cerebellar position. So this is called heel to the shin test. And go to your opposite leg and rub it slowly against it, up and down. Okay, and then do it with the other leg. Okay, and next I'm going to do nose to finger test. So touch your nose and then touch my finger. Then touch your nose. Again, do the same. Okay, so the coordination was normal. Okay, you can have a seat. Okay, so my assessment is complete, and for the teachings, I would suggest you do not wear any sunscreen. Or do you? So I would suggest highly for sunscreen at least SPF 30 and above. So whenever you go out and try to, if you just absolutely hate sunscreen, I would say like try to cover your skin so you're not exposed to the UV radiations as much. But I would suggest SPF 30 or higher at least, and then avoid tanning beds and all that, and try to stay hydrated, enough water intake, and then follow your doctors at least yearly, even if it's for the screenings. Okay, and I would end my assessment here, and I will let the provider know, and he will be with you in a little bit. Okay, thank you.
All right, sir.